Welcome everyone. Welcome to the Art of Healing Gurukul Initiative Ghar Homeopathy Project. Train the Trainer program where we are going to train about a course in the awareness in the emergency medical conditions, first aid, CPR and role of homeopathy. So everyone is set ready to go for today's remaining topic. Yesterday, we all learned about the CPR, and today we are proceeding forwards for the Hemliechs maneuver and the further part of the CPR, which is remaining from yesterday's topic. And today's core topic is role of homeopathy. Role of homeopathy in emergency conditions. So homeopathic medicines are completely safe, having no side effects. And it's very safe for the lay people also to take, except for, we have to take care that they don't just repeat the medicines blindly without the consultation of the doctors. Because we have to warn them, even though you use the first aid kit, a support will be given from the doctor. Okay, so you can modify the support, like you can, before giving the first aid kit, you can tell them that you have a 1 hour of, discount consultation or free consultation, whatever you feel like, either discount consultation or free consultation before giving them the first aid kit. And then you can explain them in that consultation about how to take those medicines and everything. So the total guidance will be free. From my side, usually it is like that only. So when I give anybody, I give travel kits also. I give pediatric kits. Okay, I give kits to the honeymoon couples. So there are different kits which can be given. So that is for first aid. So in case we know that what problems they can face. So for that, we give the medicines, that is first aid. So that is about first aid. So we'll continue with the yesterday's topic. I wanted to talk about the book, about the Dr. Michael Frass book, and I wanted the list. I am putting the messages, but nobody is responding. I'll wait for a few days. Some people who have responded are ready to pay the money beforehand, so that after they pay the money, then I'll just order the book. Just sharing the slide. Yeah, so this is what we were discussing yesterday about the CPR. First part is the scene safety and security. Just we'll revamp fast so that we can continue with the Hemliechs maneuver also. Then the step 2, call for help and CPR. How to apply this mask. So you can see the video there, how the mask has been applied and how the breaths or the mouth-to-mouth resuscitation is being done. CPR including giving the breaths. Okay, so how the mask has to be secured over the face. Yesterday I told you. So from the bridge of the nose to the covering the chin. Okay, and holding it with the C, appearance in this way. Okay, with the angle of the mandible here, and then fixing the mask severe firmly, and then giving the breaths. So place the mask over the person's mouth and nose and open their airway by performing the head tilt and chin lift method so that the airway becomes open. and ensure a good seal between the mask and the person's face. And give the breath for over 1 second and watch the chest rise. So when you give the breath or when you blow into the mouth, then what happens? The chest raises. So you have to watch out for the chest rise. If the chest rises, then your blow is perfect. Okay. So simply for giving the sake of the breath, you should not give it, but you should give a forceful blow so that the chest rises. Deliver the second breath. So 2 breaths, give the 2 breaths, and then again start with the CPR. Okay. So always remember, head down, chin lift, pinch the nose, blow for 1 second, check for the chest rise, again give another breath. Okay, so 2 breaths. Then continue this cycle. Again 30 compressions and 2 breaths. Okay, for 2 minutes you have to continue in this way. And then evaluate again with look, listen, feel. Let their head go back to the normal position. Okay, and repeat the head tilt, chin lift maneuver, and again start with the CPR and breath. Okay, so this is how the cycle repeats. So how much time? 20 minutes at least you have to be able to give the CPR. And it is said that within 20 minutes, if the person recovers, that's a good sign. Okay. So not beyond 20 minutes. If it goes beyond 20 minutes, that means something is very critical. Okay. If the advanced care has not come yet, if the person is not responding to that. So then give another breath and look for the chest to rise. Perform the chest compressions without interruption and should not take longer than 10 seconds to give the 2 breaths. Okay, so it should be within 2 seconds, 2 breaths should happen. And immediately you have to see for the chest also whether it is rising. So it should not be very slow. If the person's chest fails to rise within 10 seconds, begin with the chest compressions again. Okay. So that is how you have to check and begin with the chest compressions. This is the picture which shows how to lift the chin, and you have to see how the head is tilted backwards, chin is lifted, and then the nose is pinched, and then the mouth, through the mouth, the breath is given. Okay, that is how the open and clear airway is maintained. Also, if the person recovers, then you have to put him in the recovery position. So the recovery position is also shown. So that is how we put the person into recovery position. Now the CPR or the BLS guidelines, previously it was 2015, and then now even 2020, the guidelines have changed a little bit. But the main difference is only ABC to CAB. So when the previously the CPR was being taught, at that time you find it was ABC, but now it is CAB. So what is the CAB? It is the circulation, airway, and breathing. Okay, so circulation is maintained by doing the chest compressions. Along with the chest compressions, if the doctor is present, if the medical help is present, then they immediately push the IV line, give whatever drugs they give for the ACLS, and defibrillation is done, and fluids, whatever fluids are required, that is given. So that is the circulation is maintained in that way. And A is for airway. For airway, head down, chin lift, and nose pinch, and whatever airway devices, how to be applied that, like they use the mask, they use the endotracheal tube, then the cannulas. All these equipment tools are there which they use to maintain the airway, and the oxygenation is done. So that is airway devices. Sometimes the person is put on to ventilation also after, is taken into the ICU. So airway, then breathing. So breathing will be oxygenation and bag mask ventilation. Person is put on the ventilation. So this is according to the new guidelines. That is, it is also called as AHA guidelines or UK resuscitation guidelines. Okay. Now coming for the infant CPR, what can be done for the infant? So giving the CPR is little bit different for children for infants and for adults. Okay, so what difference is there that we'll see? Here, scene safety is again important. Checking the response, look, listen, feel, evaluation, okay, tap and shout to determine. And if no response, no breathing, gasping is there, give 5 breaths, okay? 5 breaths plus 2 fingers you have to use and push in the center of the chest with the 2 fingers, okay, in case of an infant. Okay, how you are going to push? Again, 1.5 inch below. For adults, how much inches? Or how many centimeters? For adults, it is 6 centimeters below. Then going below, 30 is to 2. That is 2 breaths, 30 compressions with 2 fingers for 2 minutes and 1.5 inch below. Okay, in adults, 2 to 2.5 inches below. Okay, in the chest depth. Compression depth is 2 to 2.5 inches. So then call for the help, call the emergency number, get the AED and call for the ambulance. All these things have to be done. Okay, immediately when you start with the compressions, immediately you have to do the first thing is call for help. Resume the CPR and give compressions and breath. Okay, that is done for the infant CPR. Now, practicing this can't be done on the adult mannequin. For that, another mannequin is there, the infant mannequin, which is shown here in the picture. Similar type of mannequin is there where we have to practice. And for this, again, small pillow can be used to practice. A small pillow with a small tissue paper roll. For infant CPR, you can practice on that. Now, early defibrillation. At the last part yesterday, we have seen a video. How many of you missed the video in the chat? Tell me. Yes, 5 to 6 centimeters. Yeah. Yeah, you missed the video. So yesterday we saw a video that showed how to use the AED and how it is important. All that we have seen. But now you can see in this picture, this is the AED machine. What is AED? Full form of AED? What is full form of AED? Automated external defibrillator. Okay, because it is completely automated. Now there are 2 types of defibrillator. One is the monophasic and second is the diphasic. Usually we use the diphasic only. Okay. So you find here in this machine there is a LED panel. You can see the LED panel here. In this LED panel, the rhythm is seen. Okay, so whether it is shockable rhythm or non-shockable rhythm. So this machine will automatically detect if it is shockable rhythm. It will say shockable rhythm, operate the machines, turn the machine, and then give the shock. It will say. So this is the knob here, which can be moved to adjust the joules. Okay, so it is maximum 270 joules. Usually it is there. So 200 to 270 in between you can give. Okay, looking at the capacity of the person. And then here this rhythm is seen here. Okay, and then there are these leads to apply over the chest to get these to see the rhythm, which can be seen here. Even if the leads are not present, okay, if the leads are misplaced somewhere, then the paddles are there. Even the paddles, if they are put over the chest, then what happens? See, the paddles are put like this. Okay, at the apex of the heart, left side here, it is put in this horizontal way, and on the right side along the right sternum, sternal border, this second paddle is put in this way vertically. Okay, so what is that? What is the functioning of this AED? What exactly happens when the shock is given? Do you know that? What happens? The heart is in a fibrillation, ventricular fibrillation. Usually causes of this ventricular fibrillation hota hai tabhi that to stop that fibrillation. So that is called as defibrillation. यानी जो heart का जो ऐसे होने लगता है ना, that is fibrillation. Okay, so that fibrillation suddenly it starts jerking in this way. Okay, the heart rhythm becomes like that. So to stop it, okay, to stop it from that fibrillation, what is done? This defibrillator is used. So what exactly happens when the shock is given? So at the apex of the heart, one paddle is applied, and at the right sternal border, other paddle is applied vertically. So when the shock is delivered, okay, how the shock is delivered? Okay, the paddles are charged, and then they are kept in this way on the on the person, on the chest wall. Okay, and then after keeping up, when it completely touches the skin, okay, and after that, the whoever is using the AED for giving the shock, he says all set, all clear, okay, move out. So all people move out. Nobody should touch that person when the shock is being given. So now what is the functioning of these paddles? When the shock is applied, the heart which is fibrillating, the shock applied will what it will do from left side, it will give a thrust to the chest. And from the right side, where it is vertically present along the the right sternal border, it will thrust from that side. Okay. So what happens? The cardioversion takes place. Okay. The cardioversion takes place, and then that gives the stimulation to the heart, and then the fibrillation stops. That is the mechanism behind this functioning. So that is why defibrillator is used. Okay, that is one reason. Now you see, this is the defibrillator machine. So biphasic and monophasic, two types are there. And for paddle positions, you know now how paddles are applied. At the left side, on the apex of the heart, and on the right side, along the right sternal border, vertically in this way, it is applied. Okay. Now, one more point here to remember, always remember, some people are on pacemakers. Okay. Are there some people use some medication patches? So before applying these paddles, one has to check if there is any bulge on the chest, if the person is already having a pacemaker. Okay, so at that time it should be avoided. So if the pacemaker is there, at that time also one should avoid the defibrillator. Okay, so that is one clause we have to keep in mind. Somebody raised hand. What is the problem? Okay, so remove that patch. If any medication patch is there, remove the patch. And if there is a bulge, okay, that can be due to the pacemaker. You have to ask the relative or attendant, somebody who is present with them. So see that bulge, understand mostly it is a pacemaker. Okay. Advanced life support. Okay, then the rest of the thing, when the person is taken to the hospital in the ICU, at that time, the rest of the thing like intubation, putting the person on ventilator, starting the IV fluids, and then all the drugs and all this comes under the advanced life support. So till doing the defibrillation, everything comes under the BLS. Okay, BLS और ACLS में ये डिफरेंस है. Okay, BLS में कहाँ तक सिखाते हैं? जहाँ तक जो कि डिफिब्रिलेशन देना तक सिखाते हैं. फिर आगे जो ड्रग्स क्या देना है, उसका मॉनिटरिंग कैसा करना है, ये सब एडवांस्ड कार्डियक लाइफ सपोर्ट में सिखाते हैं. This is the AED for adults, how it is applied. Okay, turn the power on, expose the chest, apply the pads on the victim, connect the pads, clear the person. All clear, you say, and all people move out. And the person who is applying that shock stays near the person and applies the shock. Okay. And analyze the rhythm. Follow the prompts which are given by the AED. Okay. So the machine itself says shock advised, no shock advised. Okay. Check connection. If there is any fault, the AED says check connection. So these are the prompts which are given by the machine itself. So it is very easy to operate the machine, except for you have to know where to apply the pads. That is very important. Okay. So applying the charging the paddles and applying the paddles, that is important, that you have to know. and following the prompts also. You have to understand what prompts are given. Resume the CPR with compression. So after doing the defibrillation, giving the shock, what you will do? Resume with the CPR and the compressions. If a person has a medication patch, then remove it before applying the AED pads. Also, if there is a bulge due to a pacemaker, okay, then avoid placing the AED pads on this device. And just adjust those pads to the lateral side of the trunk. Okay, sometimes the AED malfunctions or does not work. ऐसा होता है कभी कभी AED खराब हो गया है तो फिर you have to keep on doing the CPR till the additional help or the advanced care comes. Okay, additional medical help comes. Till then you have to continue doing the CPR. Now, that is a question which arises that when to stop the CPR. Okay, one thing during the evaluation for few seconds you can stop. Few seconds means within 1 second you have to just evaluate. Okay, during the evaluation, during the defibrillation. Then once the help arrives or somebody else takes over the resuscitation or the CPR. So only to prevent the tiredness or exhaustion, because one person can't carry on doing the CPR for a longer time. So there should be two people who just interchange, okay, doing the CPR. So during that time when the person is taking over, at that time a few seconds, there is a gap. But when asked to stop TP, also the CPR leader, especially there is in the hospitals, there is a code blue team. So that code blue team, the team leader asked, stop the CPR now. At that time, one can stop because one has to follow the team lead. Checklist, you have to see for the reversible causes of the 4H and 4T of cardiac arrest. Okay, in 30 minutes. That is after starting the CPR within 30 minutes. The checklist should be confirmed. Okay, so what are the 4H and 4T? So what is the 4H and 4T? Do you know? Sorry. What is the 4H? Sorry. 4H. Anybody tells in the chat? Okay. So now when to stop CPR, that 4H and 4T have to be evaluated. Okay. Because reversible causes where the person can come out of that, condition. So 4H, under that comes the hypovolemia. Blood volume has become less. Hypovolemia and hypoxia, where the oxygen, okay, is not getting to the brain. Then hypothermia, okay, and hypo or hyperkalemia, potassium, okay, hypo or hyperkalemia. These are 4H. These are reversible causes, okay. And now coming to the H, 4H. In the 4H, am I not audible? Am I not audible? Yeah. Okay. So 4H is hypoxia, hypovolemia, hypothermia, hyperkalemia, and hypokalemia. Okay. And coming to hyperglycemia is also one thing. It is not called as 4H, it is called as 5H. Okay. This is the old one. See, hypoxia, hypovolemia, hypothermia, hypo or hyperkalemia, okay, and the hyperglycemia. Just correct it. So 5H and 5T have to be evaluated. There should be a checklist. ये नहीं है, ये नहीं है, ये नहीं है, ये नहीं है. Okay. So 5T, what will be evaluated for 5T? What are 5T? 5T is tension pneumothorax. Tension pneumothorax, thrombosis, pulmonary thrombosis, coronary thrombosis, toxins, any trauma or cardiac tamponade. Okay. So tamponade, one is this tamponade, trauma, T for trauma, toxins, and thrombosis. It can be pulmonary thrombosis, coronary thrombosis. Then tension pneumothorax. These are the 5 T's which one has to evaluate. These are the reversible causes. Okay. Then tiredness. If the person is very tired, then also one has to stop, because taking care of oneself is also important. Tired in the sense so exhausted that one will collapse. DNAR status. Do not resuscitate. Do not attempt resuscitation is one factor. Okay, so where person is given an order that do not resuscitate. Either it can also because of certain terminal illnesses and all. Usually the relatives, okay, they fill a form. In the foreign countries it is there, in India also it is there. So they ask the doctors do not resuscitate. Okay, so that is one exception, you can say. Okay, so do not attempt resuscitation. So these are the different factors when to stop the CPR. So clear? CPR is clear? Do you have any doubt for this now? Clear? CPR is clear? All clear? Set to go for the next topic? Okay. Now choking. Choking is very common problem. Okay. Many times people choke. So fortunately, they will come out of it because there is already a defense mechanism, gag reflex, because of which the person coughs and immediately comes off. If small particles are there, immediately that comes off. Okay, but in case if a foreign particle gets stuck inside the trachea, then the person suffocates, gasps. Okay, and one can understand the person is choking. Immediately, what has to be done? And this action, the procedure which you do is called as Hemliechs maneuver. Okay, so in this Hemliechs maneuver, how this Hemliechs maneuver is conducted? If suppose you are alone, nobody is there to help you out. Choking हो रहा है और कोई हेल्प करने के लिए नहीं, तो कैसे करोगे? तुमको पीछे से चेस्ट थ्रस्ट देने के लिए कोई नहीं है, तो क्या करना है? You see this person bending over the back of the chair. So कोई भी ऐसा hard object रहेगा जहां पर ऐसे bend हो पाएंगे, है ना? So go against that edge of that hard object and bend over that. Okay, so bend over that at the epigastric region, at the epigastric region, that hard edge of that chair or the back of the chair, that should press against your epigastrium. Okay, it should press against it and bend over it, and with your own, make a fist like this and put it in the epigastrium along with the edge of the chair and give the thrust for yourself. You have to give the thrust for yourself. Okay, so that is doing the Hemliechs maneuver for self. That can be done. Okay, when nobody is present, you can do it for yourself in that. And if somebody is like a child is there who is choking, what will you do? You will ask the person to bend like this and then hold from one side on the chest in this way, and from another part, okay, on the back side with the other hand, you have to give him the, thrust. Okay, thrust, how to give? How many thrusts? 5 thrusts. Okay. Another thing is making a fist and putting in the epigastrium and giving 5 thrusts at the epigastrium, pushing it upwards. Okay, inwards and upwards. The direction should be like that. Okay, inwards and upwards. So it goes deeper and thrust is applied upwards, so that whatever the foreign body is there, that will come out of the throat. Then that is how it is done. So you can see here in this picture how the person is applying the back thrust. One hand on the chest, other hand on the back, and giving the what? Thrust. Okay, so that thrust is given in this way. So that the whatever the foreign body is there, it come out through the mouth. And here in this other picture, what you see, the person had made a fist and applied it over the near the epigastrium, just below the rib border and the abdomen. Okay, and then he is giving the thrust at the rib border. Okay, in the center. And that thrusts are also applied in the depth and inwards and upwards. Now here you see this is a pregnant lady. Now in case of pregnant lady, what will you do if she chokes? So here you see how the person is, holding the lady above the abdomen, okay, above the abdomen part, and giving the thrust upwards towards the chest. Okay, so that is how one can give the thrust, and back thrust can be also given. Okay, so that is how you apply the thrust and do the Hemliechs maneuver. This is for adults and children. Now, this is the Hemliechs maneuver. Okay, this is how the fist has to be made. It can be, it has to be held over at the epigastrium in this way, and then with the other hand pressing over it and giving the thrust. Okay, अभी ये सब practice किए बिना नहीं आएगा. Okay, you have to practice this. Now you can make a group amongst yourselves there, and you can practice these Hemliechs maneuver and CPR and all these things. You can make a group. You can have some volunteers also to do that. But remember, the CPR can't be done on humans who are like normal. It will be painful for the people. So it is better practiced on the pillows, cushions, or you can practice on the mannequins, remember. Okay. Now for the infant choking, what has to be done? Infant choking. Infant is, what is infant? How many years comes under the infant? Kitne age? What should be the age? Infant? Till 1 year. Yes. So till 1 year. Okay. So from the newborn, 1 year infant choking, newborn, infant. So what is done here? The baby is made to lie on the, first you have to just sweep the mouth, okay, suction if something is there, and then that should happen in fractions of seconds, okay, and put the baby in this way, okay, and head downwards, tilted downwards, and on the back give the 5 back blows, okay, 1, 2, 3, 4, 5. Okay, and then turn the baby again. The head should be a little bit downwards, and then with the fingers, 2 fingers, okay, give 5 chest thrusts. Okay, 5 chest thrusts. So alternately you have to do. And while doing this, you have to check for the consciousness, any sounds, and cyanosis, blueness. Okay, if the person, if the baby is suffocating, turn into blue because of the circulatory disturbance. Okay, so that is infant choking, and here abdominal thrust in case of the Hemliechs maneuver for adults. Okay, in case of pregnant, you have to remember all these things. How to do it in a pregnant lady, in a if a person is alone, and if a person is accompanied by somebody else. So all these things you have to remember in case of the Hemliechs maneuver. Now we'll go for the homeopathy in emergencies. Common things, common. Now in our first aid kit, we have very common remedies. But as per our case discussion and all, already we had one session, okay, where we discussed cases with Dr. Michael Frass. After completion of this course training, we are going to again conduct one webinar where I will discuss different cases where I have solved the problems like severe hypertension, okay, and where there were catheter-induced infections, and pre and post-operative care. All these discussions we'll do after completion of this course. Now at present, I will discuss only the medicines which should be kept in the first aid kit. Okay, homeopathic first aid kit. So fever. For fever, we commonly use, we all know, paramphos, bryonia, belladonna, aconite, sulfur. Okay, so these 5 medicines are the prime medicines which are very useful in the fever. So in the early stage, when is paramphos used for fever? Whenever there is inflammation, it is an inflammatory fever. Okay, like boil in the ear fever. There is somewhere, okay, an inflammatory stage, and it gives rise to acute pain and fever. Paramphos. Paramphos biochemic powder. Okay, powder is also applied on the wounds. Okay, in the early stages of inflammation to abort the inflammation. Bryonia. Bryonia, you know, this is the best time to use bryonia. When the winters have gone and the rain and the summer has started. Okay, and many people fall ill. Intense thirst is one of the common symptoms during this stage. No, so bryonia is suitable. Belladonna again, inflammations. Okay, inflammatory fever. The difference between belladonna and paramphos, belladonna is more violent. The typical rubor, okay, that is there. Calor, all these things. Okay, the violence, delirium, okay, and dryness of the mouth. Dryness is more common. Redness of the face, and then you have this thirst for thirst, and then aconite is also there. Aconite is when one faces suppose ट्रैवलिंग करके आया और ट्रैवलिंग में विंडो के सामने बैठा हुआ है और देयर इज अ लॉट ऑफ एयर फ्लो. ओके, इट नीड नॉट बी नॉर्थ वेस्ट विंड्स एंड ऑल, बट बहुत हवा आ रहा था और हवा फेस किया दूसरे दिन और रात को, नहीं तो फीवर आ गया, बहुत जोरों से फीवर आ गया, वायलेंट फीवर. Okay, so that is a acuteness of the fever. So there you can give aconite. Now sulfur I have used many times to cure fever. Okay, sulfur in lower potencies. It is especially in small children. Sulfur 1 dose, if you give, even the unresolving case of fever will solve. So very beautiful remedy, sulfur. Now I don't suggest any specifics, but I'm telling you these are the facts, that these are the few frequent remedies which have been given for fevers. Okay, so in the first aid kit, one can keep these medicines for fever. And the beauty of this is that many cases, children, they have the constipation. A few doses of bryonia, without even not looking at the constitution and all, you give a few doses of bryonia and the constipation is gone. Okay, along with all other symptoms. Most of the times I ask the person, fever during this season especially, okay, ये जो summer start होता है ना, start of the summer में, okay, constipation है क्या पूछती हूँ, then प्यास कैसी लगती है पूछती हूँ. ये दोनों symptoms के ऊपर bryonia I give and the fever is gone. Okay, I have cured cases of fever with nux vomica also. Okay, So give 1 dose of Nux vomica in the evening and see the morning till morning the fever is gone. So ferrum falls, there are types of fever that normally start slow and turn quickly into hot flashes of salts. And ferrum falls may work to keep the body naturally bringing down the fever and then curing all the other symptoms as well. Okay. No thirst with fever, belladonna, bryonia with lots of thirst. Okay. Now coming to the injuries, contused wounds, arnica, okay, falls, blunts. I've given arnica for so many cases, kitne sare cases, okay, especially children, small children. अपने खुद के बिल्डिंग में के जो बच्चे होते हैं ना, वो बच्चों को लेके आते हैं, फॉल हो गया तो मेरे पास से लेके आते हैं विदाउट गिविंग द मेनी पेन किलर्स. So give 1 dose of arnica and you see within next day you will find that black and blue appearance of the wherever that swelling has happened and the black and blueness of skin is there, everything disappears within 1 day. So that is the beauty of homeopathy. Falls, blunts, contused wounds, head injuries with disorientation, black and blue appearance, soreness, can't find rest in any place. और ये symptoms तो हम सब जानते ही है ना. Or another thing, arnica was used. In some book I have read, arnica was used for PTSD, post-traumatic stress. Okay. So stress disorder. So what is this post-traumatic stress disorder? It is an emotional trauma. Okay. So emotional trauma after some traumatic incident. Okay. The trauma remains in the person and that person goes into a clinical depression. Okay. So this kind of post-traumatic, this kind of trauma is an emotional trauma. So this can be after a disaster. बहुत बड़ा डिजास्टर हो गया है, जैसे कोविड हुआ है, कोविड के बाद बहुत लोग पीटीएसडी में गए हैं. ओके. वैसे ही एक जगह पे earthquake हुआ था और earthquake होने के बाद बहुत सारे लोगों को आर्निका दिया गया for their PTSD and they accepted the situation easily and rolled on to the further their future. Okay. So that is how, beautifully the arnica also acts at the mental plane. So it is also a contused wound only, which can't be seen, like it is an internal wound, which is not seen externally, but it is a contused wound, like the internal wound. So emotional trauma also arnica is used. Arsenic is frequently used for food poisoning. Now, you know what kind of food poisoning happens in arsenic, which is given in our materia medica. Food poisoning, beautiful remedy for gastroenteritis without preventing all the complications. ज़्यादा IV fluids भी लगाने की जरूरत नहीं, जल्दी से dehydration भी recover हो जाता है. Okay, so initially you may be applying like ज़्यादा IV fluids लगाने की जरूरत नहीं पड़ती. ज़्यादा hospitalization में रहने की जरूरत नहीं पड़ती है. It will cure the case very fast. Okay, so gastro-like symptoms after food poisoning, eating the domain poisoning is one word which is given in our materia medica. Okay, so after eating fruits, decayed food, arsenic is given. Also in viral fevers, in COVID, we have used like mads, arsenic album for many people to prevent. Okay, and also as a prophylactic as well as for boosting the immunity. That is the word which was given by Ayush, because evidence-based medicine, we are not supposed to use the word prophylactic. That's why. So for boosting the immunity, we had given arsenic to so many people. Anxiety and the wonderful thing about it is that those who have taken arsenic never got COVID in a serious way. Even if they got the COVID, it was only for a few days and they recovered very fast. Such a beautiful thing. Anxiety, fear of death, restlessness mentally, physically too weak to move. These are all these common symptoms which we see in arsenic. restlessness is the most common one. Okay, but there is again a difference between arsenic and aconite. We all know. Okay, the violence of symptoms is seen in the aconite. Epismell, insect bites, bee stings, scorpion stings. Epismell can be given. Okay. One of the remedy for scorpion sting is also silesia. But always remember, scorpion sting, snake bite, poisoning, all these cases have to be referred to a government hospital. Okay. This is only first aid which we are talking about. Only as a first aid. Calendula ointment. This can also be kept in the first aid kit along with the pills, calendula pills. So all these medicines are given in lower potencies. In the first aid kit, we all have the medicines which are in lower potencies, not in higher potencies. So calendula, apply the ointment to the open cut wounds. It acts like a broad spectrum antibiotic cream. जैसे पोविडोन आयोडीन का बॉटल होता है एंड इसमें सैवलॉन होता है फर्स्ट एड में, ये सब रखने की जरूरत ही नहीं है. यू कैन सिंपली कीप calendula ointment, one tube, that is enough. Even if that is not there, you can keep the tincture, mother tincture with diluted mother tincture. And pills, calendula pills are also very useful in cases of deep cuts and wounds. Then cantharis. Cantharis is again a medicine which can be used for the burns. You all know the symptoms of cantharis, the blebs formation, the scars, okay, burns. So till the partial thickness burns, you can use cantharis. Even in full thickness burns also you can use cantharis. Nitric acid is one. Now this is the clinical aspects we are discussing. We can't give all these medicines in the first aid kit. What we can give is only cantharis. Okay, so pills, cantharis pills will be there, cantharis ointment will be there. Glonoine. Glonoine is a very beautiful medicine, you know, like it acts like wonders for the hypertension, also for the heat stroke. So what symptoms you'll find? Sudden local congestion, all the symptoms of the heat stroke, which we discussed in the earlier lectures. So local congestion is there, head and chest is congested, there is a bursting headache, okay, and which arises from the neck above. There is a great throbbing, a sensation of expansion and bursting headache. Okay, you can't bear even the least movement, can't bear anything on the head. Even the hat, the person is unable to bear on the hat, in the head. So overheating in the sun and sunstroke is one of the etiological feature causes, which is mentioned in our Materia Medica. So glonoine is a very good medicine for heat stroke. Apart from that, when there is a mild headache leading because of the sun, that can be the Natromure can be used, right? Natromure can be given, and if it turns into a severe thing, then glonoine. Ignatia. So these medicines itself will not, along with that, the first aid care has to be given, remember. Ignatia. Ignatia is for the sudden grief. घर में कोई किसी का मृत्यु हो गया, sudden financial loss, some kind of sudden excitement because of which, there is there are symptoms which arise, historical symptoms, falling down unconscious, hearing the excitement or news, bad news, okay, loss of or death of a loved one or pet, okay, heartbreak, or relationship issues, homesickness, disappointment or any failure. एग्जाम में फेल हो गया, रिजल्ट निकला, बच्चा अनकॉन्शियस हो गया, okay, फीवर हो आ गया कुछ, तो these are the different symptoms because of which, because of these are the etiological factors or the causes because of which the person suffers. So when you have all these, factors because of which the symptoms have arisen, then Ignatia is the best medicine to give. And I have given Ignatia in so many cases. In one case where I had given Ignatia, a lady had come to me with 20 years of grief. Remember, 20 years. She was unable to talk. And when I was talking to you, she was just, her tongue was like, this is what she was to do. She was not able to talk. She was just moving the tongue. And when I looked at her, no, I felt I have to give like kisses to her. But then after taking detailed case taking, I came to know that she had lost her son, who was a very grown-up son. Okay. And grown-up son, after losing her grown-up son, she immediately fell sick and she lost her voice. That was the only reason. From that moment onwards, till 20 years, she was suffering with that. She never regained her voice. And this Ignatia, imagine, I was awestruck that after taking Ignatia, a few doses, within 1 week, she started speaking. That in my history of my clinical practice, I was really, wondering that about this cure. Natmure, severe hammering headache. This is the early stage of even the heat stroke or even in the early cold. When the early sneezing वगैरह start हो जाता है ना, starting में there is a like a aura, कि अभी मुझे सर्दी होने वाली है ना, तो immediately few doses Natmure 30 का एक डोज ले लिया ना, तो वो सर्दी आएगी भी नहीं. ओके, सो सिवियर हैमरिंग हेडेक से स्टार्ट होता है और फिर अर्ली कोल्ड स्टेज स्टार्ट होते हैं, तो Natmure works very nicely. Cocculus and petroleum, you all know it is used for car sickness. So depending on the symptoms, you have to give the cocculus or petroleum. Euphrasia is for eye drops. Eye drops are also there, pills are also there. You can use both in case of the eye flu, conjunctivitis, viral conjunctivitis, which is called as. But we know the symptoms of this, and so many cases when the viral flu ka season start ho jata hai na, so it's like, all people come for this medicine. It can be given as a prophylactic also. जिसने यूफ्रेसिया का पिल्स ले लिया, आई फ्लू आएगा नहीं उनको, चाहे सब लोगों को आई फ्लू आ रहा है लेकिन इसको आएगा नहीं, और आ भी गया तो विद इन बहुत जल्दी निकल जाएगा. दैट इज होम्योपैथी. नाउ रेस्क्यू रेमेडी, any kind of emergency, आंख मूंद के how we can give the rescue remedy. How it works we don't know, but the person is rescued. The name of the remedy itself is rescue remedy. Okay, emotional trauma. Okay, जो भी कुछ हो गया, एक्सीडेंट हो गया, इनिशियल जो शॉक होता है ना, बिकॉज ऑफ दैट पैरासिम्पैथेटिक एक्टिविटी, द पर्सन डाइज. लाइक स्नेक बाइट में बताया था ना, हाँ, पॉइजनस नहीं भी है स्नेक, लेकिन वो जो नर्वस एक्टिविटी जो हो जाता है ना बॉडी में, बिकॉज ऑफ दैट द पर्सन डाइज. ओके, सो always remember, rescue remedy works at the mental plane and prevents that parasympathetic activity, sympathetic activity, and then what happens, the recovery starts and the boosting up of the vital force. चलो उठो, कुछ नहीं हुआ, चलो उठो, ऐसे बोलती है वो rescue remedy, और the person gets up, okay, and is tempted or given a thrust to become well fast. Staphylococcus aureus. This is the medicine which I give to people who go for honeymoon. Okay, आते हैं लोग ट्रैवल मेडिसिन करके आते हैं, हम लोग कहाँ जा रहे हैं घूमने के लिए, कपल्स आते हैं, ओके, घूमने जा रहे हैं और मेडिसिन दे दो हमको. So along with some medicines like cocculus, petroleum, nux vomica, I give the Staphylococcus aureus also. Okay, so that they don't get this honeymoon cystitis or urinary tract infections, which are usually faced by these new couples. Urticarians. Urticarians is a very fast acting medicine, कोई भी एंटीहिस्टामिनिक और कोई भी मेडिसिन इतना अच्छा काम नहीं करता है. अर्टिकायूरेंस इतना अच्छा काम करता है. रैश, especially in the pollen season, allergic dermatitis, urticarians. ओके, कहीं फॉरेस्ट में जा रहे हैं घूमने, के गार्डन्स में जाने हैं, तो किसी लोगों को एलर्जी होती है, ओके, तो अर्टिका यूरिन्स कैन बी गिवन, ओके, सो दैट दे कैन टेक अ फ्यू डोसेस एंड द रैश इज गॉन. Rustox. Rustox is a common medicine we all give for sprains due to overstretching. Also, after the rain में भीग के आ गए और immediately उनको body ache start हो गया, fever start हो गया. At that time, best remedy to give is the Rustox. After getting drenched in the rain or in the water, Rustox cures that fever. Okay, and also swimming करके आए और fever start हो गया. Sore throat, fever, body ache, everything, Rustox. Give Rustox. Okay, so that is one remedy for fever also. Apart from that, it's a very good sports medicine. Ligaments, okay, tear of ligaments, there is sprains, overstretching. जो भी people जो overstretching करते हैं, okay, जिम में जाके जो stretching exercises वगैरह करते हैं, उसके बाद जो भी उनको effects होता है body पे, जो भी symptoms आते हैं, उसके लिए Rustox is good. Okay. Again, so many people Rustox and beautifully acts. Now, who says that homeopathy doesn't work fast? Without any side effects of the painkillers. जैसे पेन किलर लेने के बाद बहुत सारा फियर भी होता है ना कि इससे एसिडिटी हो जाएगी, इससे वो हो जाएगा, ये हो जाएगा ना, तो वी डोंट हैव दैट काइंड ऑफ साइड इफेक्ट्स इन दीज मेडिसिन्स एंड दे एक्ट फास्टर आल्सो. So only how to see that the causative factor that has to be understood. किस वजह से हुआ है? Okay, like Rustox after drenching in the water, getting drenched in the rain after swimming. That is one thing. And the Rustox is also for the after the overstretching. That has to be remembered. Of course, the restlessness and all things happen with the other factors. Now, magphos in biochemic form I give usually, okay, in children, and in adults I give 30 and 200. So I always start with the lower doses and increase to higher. So magphos, abdominal pain due to gases, bending over because of the gases, there is terrible pain, the person almost cries, and dysmenorrhea also one can give magphos. So how is magphos biochemic I give? I give it usually with the crush. I ask the person to crush that tablets and give it in the warm water. Okay, every 1 hour or every 15 minutes, depending on the intensity of the symptoms. Okay, so that is how magphos can be given. Now, Nux vomica. Nux vomica तो इतने बार दे चुकी हूँ लोगों को, बाप रे. So almost the people who are in a executive state, position, officers who have a sedentary life and lot of pressure, work pressure. These people are very ambitious also. Those people who are working for their, careers, like 24/7, they are preoccupied with their work only. So ambitious they are. So all these people who have got like weekends, they have parties and all. After this, they come and then they have these symptoms like hyperacidity, hangover, all this indigestion, all the typical symptoms of Nux vomica. We know that. So, and also with that, one of the thing is urging for stools. Frequent urging for stools is there, not getting evacuated completely. All the symptoms we already get from the patient. So while we give as a prescription remedy, we all ask these symptoms. But while giving it as a first aid, remember, for a first aid, एसिडिटी हो गई है तो किसको देना है, वो पेशेंट को हमको ये सब समझाना पड़ेगा. किस तरह के पेशेंट को एसिडिटी हुआ तो क्या कौन सा मेडिसिन देना चाहिए. Okay, so what are the different medicines? Can you put in the chat for which acidity we give? Nux vomica is one. Little bit of interaction. What are the medicines we give for the acidity? Clinical. Pooja says, I never even allowed others to say it works wonders. Sulfur, sulfuric acid. Yeah, Robinia, right. Yeah. Nat phos. Nat phos. How many of you remember nat phos for acidity? So, we have so many beautiful medicines. Why wonderful? Why can't we say wonderful? Because it acts wonderfully. We have to say it is wonderful. But uh, the law doesn't allow us to tell the word wonder. No, wonder drugs. So law doesn't expect us to. We can't say like that. But the patient tells, no, it acts wonderfully. Patient comes and tells us, मैम क्या दिया आपने, जादू कर दिया, हाँ, गायब हो गया सब symptoms. Patient comes and tells us, no, then who can stop this patient's mouth? So ऐसा होता है. तो नक्सवामी का हैंगओवर आफ्टर द रिच फूड, अल्कोहल, पार्टीज, ये सब होने के बाद फिर ढिकार लेते हुए पेशेंट अपने पास आते हैं और हम नक्सवामी का देते हैं और फिर सुबह तक सब सिम्टम्स गायब, है ना. फिर इतना अच्छा काम करते हैं. Lidampal now, see, after the lumbar puncture, pain persists, post-operative, remember, Lidampal. Homeopathic anti-tetanus. It is not falsely called as homeopathic anti-tetanus. Mosquito bites. जो mosquito bites होने के बाद जो पर्सन को जो वीकनेस आता है और जो बाइट के मार्क्स रह जाते हैं, टर्न ब्लैक आफ्टरवर्ड्स. Okay, the bite, the insect bite or the mosquito bite, it turns black afterwards. Then Lidampal can be given. Punctured wounds, Lidampal can be given. Give a few doses of Lidampal. It will act as a anti-tetanus also prevent the pain and the pus formation, acts on the sentient nerves. So that is a very good remedy which can be given. Symphytum, fractures के लिए. तो fractures को तो additional care लेना ही पड़ेगा, है ना, depending on the type of fracture. But symphytum is a medicine which acts in healing the fracture very fast, है ना. So depending on the different factors like age, okay, and the person who suffers from diabetes, hypertension and all, they can't take other medicines, so many medicines. So if you give symphytum in lower potencies, symphytum mother tincture is also given, but in first aid we don't give that. We can give only the lower potencies. So fractures, eyeball injury, heals and joints fractures very faster and prevents the contractures and stiffness. बहुत बार क्या होता है ना, वो प्लास्टर ऑफ पेरिस वगैरह इसमें बैंडेज करके रख देते हैं और फिर जब वो निकालते हैं ना तो देयर इज अ स्टिफनेस हैपनिंग. ओके, स्टिफनेस हो जाता है, कभी कभी कॉन्ट्रैक्चर्स हो जाते हैं, कभी कभी फ्यूजन हो जाता है जॉइंट्स का, जो जॉइंट्स का फ्यूजन हो जाता है या तो बोन्स का फ्यूजन हो जाता है. ओके, बिकॉज it is healing, no? So during that healing stage, it joins together. And because of that, there is a stiffness, there can be contractures. Also, after the prosthetic surgeries, we can give symphytum. Okay, so splinting and prosthetic surgery after plasters, to prevent, we can give symphytum. Okay, so that can be included in the first aid kit and given whenever any case of fractures or wounds to the bones happen. Ruta gravulans. Now, ruta is frequently used for ankle injuries, small joint sprains and pains. The ladies who walk on high heels and suddenly the ankle twists and then there is a sprain in the ankle. Ruta works very beautifully. Okay, bone injuries, orbital injuries. Ruta is a good medicine for that. Phosphorus, epistaxis, very frequently used in the bleedings. Epistaxis also. So it's the best medicine to control the bleeding from various parts. Along with that, we have so many medicines. Millifolium hai, trillium hai, different kinds of hemorrhages. But phosphorus can be kept in the first aid kit as a specific or as a first aid remedy. Now this is my favorite medicine because I am a trekker. I always carry this coca medicine. Okay, coca being the first aid medicine popularly known as mountaineer's remedy. I carry this coca, nux vomica, and arnica with me always when I go to the trekking. So coca being the first aid medicine popularly known as mountaineer's remedy, anyone can get it who hurries into ascending at high altitudes without giving their body enough time to adjust to the changes in the air pressure. So beautifully it is given in our materia medica. Okay, जब लेह लद्दाख को जाते हैं ना लोग, तो वहां पर एक्स्टम करने के लिए पूरा एक दिन रुकना पड़ता है, लेकिन अगर कोका लोगे ना तो उतना देर रुकना भी नहीं पड़ेगा. But government doesn't allow. They ask one day. They don't allow people to go ahead without staying there for one day. Okay, so they see the arrival and departure, the timings when they have come and all that. But Hoka, in case you are going for a high altitude, if any people are there who really suffer from mountain sickness, even if they stay for one day, there are chances that they will suffer from the sickness. Okay, low oxygen is there at high altitudes. So this Oka gives a that kind of altitude sickness is gone after taking Oka. So you can imagine I climbed Kedarnath, okay, after taking this Oka. Pura bag leke chalte gaye upar. Yes. That was because I don't belong to that northern states and that area of snowy region, but still I was happy that I could do that. So coca can be given to people who do the mountaineering or people who go to that areas for trekking or as a tourist spot to visit that areas. So they can get this low oxygen and all the symptoms related to it. Coca can be given in 30 potency as well as in tinctures. Hypericum is a medicine for the nerves, okay, and fall on the coccyx or any crushed injuries, fingernails, this many small children, they get a crushed injury. Many times it happens. Small children, they have a habit of putting the fingers in between the door hinge, and the door suddenly closes and the finger gets crushed. So many cases I have given hypericum. Okay, painkillers लेने की जरूरत नहीं है. And that pain goes away very fast. Fall on coccyx, injury to the spine, nerve, so any kind of nerve injury, hypericum. Okay, 30 potency and slowly increasing the potency. This is for clinical practice. For first aid, 30 potency. Okay. The Merxol. Now, Merxol, you can say otitis, ear pain with discharge, dentistry also carries pain. Merxol is used. Also a very good remedy for the mouth ulcers. Okay, Merxol. There are two medicines which are frequently given for mouth ulcers, Merxol and borax. How many of you have the experience of giving Merxol and borax frequently for mouth ulcers? I sing the song Coca-Cola too. Yeah, Rajni has the experience. Many of us have this experience that the Merxol and Pooja ke saath mein hu main aaj. Merxol and borax. Okay, these are frequently given for mouth ulcers. Then you come to the pulsatilla. So along with magpos, one of the beautiful medicine is pulsatilla, especially in dysmenorrhea, menstrual pain, left-sided, amelioration by consolation. The patient comes to us with a weeping, a frail person, beautiful person. Yeah? So pulsatilla. लेकिन फर्स्ट एड में पल्सेटिला हम देते हैं लोअर पोटेंसी में, 30 पोटेंसी में, एंड menstrual pain में it acts like a specific. So it can be given as a first aid for pulsatilla, for the dysmenorrhea. Now This was the medicine which was suggested by Dr. Frass. Grindelia, arsenic, and phosphorus relieves from intubation fast. Okay. I really wish that I could have known these medicines when I was, my husband was admitted in the hospital. And I regret that, I didn't take so much interest in intensive and emergency care medicine. I was just practicing and I just neglected this part because we all are taught that homeopathy, acute conditions, there is no scope. That is what we learned in Organon, no? We never explored with our own minds. है ना, अपना माइंड लगाया है क्या हम लोगों ने? मैंने तो नहीं लगाया था, है ना? अभी मेरे माइंड में ट्यूब जल गया कि नहीं है, ये ऐसा नहीं होता है ना? So I started exploring only after I got a shot. तो जब तक हमको ऐसा शॉक मिलता नहीं है ना, तब तक हम सुधरते नहीं है. तो क्या होता है कि जब तक वो खुद को एक्सपीरियंस होना चाहिए कि ऐसा कुछ हो जाएगा, तब हमको दिमाग में आता है कि ऐसा क्यों हो रहा है ना? तो Dr. Franz told me that Grindelia, arsenic, and phosphorus he has given to many patients to relieve from intubation fast, because there are patients who are there on intubation for months together. Okay. 1 month 2 months तक इंट्यूबेशन पे रहने वाले पेशेंट्स है. So it's very difficult, इतना easy नहीं है intubation, and we can't see that person. If a person is a loved one or very near person to us, it's very difficult. Patient को तो हम किसी तरह से देख लेते हैं क्योंकि हमारा अटैचमेंट नहीं होता है उतना पेशेंट के साथ जितने अपने क्लोज रिलेटिव्स के साथ या अपने क्लोज पीपल के साथ होता है ना? तो it's very difficult condition. So if you save a person's life, relieving them of intubation very fast, कितने दुआएं मिलेंगे ना? पैसे का तो छोड़ दो, हाँ, दुआएं कितने मिलेंगे ना? तो Grindelia, arsenic, and phosphorus relieves from intubation fast. Okay. Now there is a lot of exploration has to be done. Now भी ये medicine तो हमको पता है, लेकिन now see how many of you are here? 16 people are there. Out of you, if you have some of your relatives who have their own hospitals, or suppose you own a hospital, you can give these medicines and check whether it really works or not. Dr. Frass has given us his experience, but we have not experienced it, so we can give these medicines and see that how it works. And that is what is science, exploring things and proving evidence-based medicine. So we have the evidence then after giving this medicine, the person relieves fast. है ना? तो ये trials तुम लोग कर सकते हो ना, after you get a permission from the proper authority. For that only we are trying all these things. So next medicine is Nat Self. Nat Self is again like arnica, concussion. But arnica is an acute one, concussion immediately giving arnica. But Nat Self is a medicine which has a bad effects of a concussion. Some years back, he had got a, injury on the head and the after effects remain. Nat Self. So the symptoms, loss of memory, headache, okay, twitchings, epileptiform convulsions. If you know the reason of the epileptiform convulsions, कभी उसको concussion हुआ था head पे, वो याद भी नहीं रहता है वो person को concussion हुआ था करके, उसकी मम्मी या पापा बताते हैं कि हाँ ऐसे हुआ था, है ना? तो Nat Self, उसका epileptiform convulsions भी निकल जाते हैं, उसका headache भी निकल जाता है ना? So as a acute exacerbation of a effect of the head injury. Acute exacerbation. So it is acute condition, acute emergency medical condition. So you can give Nat Self. Okay, so Nat Self for mental symptoms following a blow on the head. Nat Self. After effects of a head injury. Aconite is a medicine which can be given for shock, panic, any kind of suffering which is related with the shock and panic in its symptoms. Sudden development of symptoms with violent physical, mental restlessness, pain, and all this. And there is a one constant symptom, that is fear of death. Okay, एक बच्चा आया था एक्चुअली मैं तभी मैं हॉस्पिटल में थी और वो हॉस्पिटल में उसको कुछ प्रोसीजर कर रहे थे और उसको यानी कंट्रोल करना, बच्चों का भी कंट्रोल करना बहुत मुश्किल होता है. So some procedure was being done and he was not at all, means even sedative can't be given to him at that time. And the child was crying so violently and he was saying, मैं मर जाऊंगा, मैं मर जाऊंगा, मैं मर जाऊंगा. That's the way he was crying. He was continuously telling, I will die, I will die, I will die. And he was totally crying like hell. And I gave the aconite a few doses, and within 5-10 minutes, I asked the doctors to relax, wait for a few minutes, and after a few minutes, he was okay. Sudden drastic changes, हाँ. इतना रोने वाला बच्चा शांत से सो गया और करने दिया, जो भी प्रोसीजर करना था वो कर दिया. So that is how it works. Aconite for shock and panic and violence of symptoms, physical and mental, and fear of death. He was just lifting all the things, instruments वगैरह फेंक रहा था ऐसे इधर उधर इधर उधर. So that was the violence. How can you compare this with belladonna? Belladonna also has violence, okay, but that violence, belladonna, is inflammatory. Okay, this aconite is at the mental plane. It's more severe. Restox we did study. Okay, in case of athletic and gymnastic medicine, in sprains, fever after drenching in water and rain. Carboveg in pulmonary failure. This was again suggested by Dr. Frass. He said that in pulmonary failure, carboveg works very nicely in lower potencies, and the typical symptoms of gasping for air, fan is required. Okay, fanning. When one's abdomen is tensed with flatulence and with pain, and this condition is worse on lying down, carboveg will help. And there is burning in stomach, which extends to back and along the spine and wants fanning from near. Okay, carboveg. This medicine works. Most commonly, I have given this medicine for geriatric patients. Okay, जो 55 और 60 के above होते हैं ना, तो उन लोगों के लिए ये मेडिसिन इवन 80s में 80s 90s जीरियाट्रिक पेशेंट, जितने सीनियर सिटीजन उतना ज्यादा ये कॉमनली यूज किया है, मैंने बहुत फ्रीक्वेंटली यूज किया है. Of course, the symptoms are very important, but I found it very useful in geriatric cases. So these are the list of homeopathic medicines for your first aid kit. Okay, so these are the numbers, number of medicines. Okay, so at a glance, you can understand for what it is used. All these medicines, this is a disclaimer which has to be put up, and told to the patients. All these homeopathic medicines are indicative for relief in the first aid on basis of symptoms and dosage. They may provide relief as first aid and are curative only under guidance and consultation with a qualified homeopathic doctor for dosage and repetition. Okay, and please contact nearest hospital and helpline immediately in case of emergency. ये disclaimer देना जरूरी है, ठीक है? There is a knowledge. This is the knowledge sharing workshop, because when you are going to train the lay people, okay, it's only a knowledge sharing workshop. For detailed usage and kit, they can contact you, those who are taking the training, okay, and they can save your number. They can call you for guidance. So it depends on how you tell them that that you can provide them the first aid kit for a whatever cost, and then you can tell them that 1 hour of consultation and guidance will be given with this, along with this kit. It can be free or discounted as you wish. You can do it. Isn't it a good thing that you're doing, right? Mute yourself. Mute yourself. Okay, so call the nearest hospital or helpline immediately, and it is a knowledge sharing workshop. Now the things which are kept in the first aid kit. What things are kept in the first aid kit? देखा है कभी first aid kit? बैंडेजेस होते हैं, एंटीसेप्टिक लोशन होता है, सीजर्स होते हैं, एडेसिव टेप होता है, ठीक है नहीं, और कुछ लोशंस और क्रीम्स होते हैं, राइट. But the main things which have to be kept in the first aid kit are bandages, roller bandages, tape, gauze, scissors, sanitizer spray or liquid, antiseptic wipes and swabs, एब्जॉर्बेंट कॉम्प्रेसेस. ना एंटीसेप्टिक जो स्वैब्स और वाइप्स है तो वो उसमें एंटीसेप्टिक लोशन नहीं होता है. दैट फॉर दैट वी कैन यूज कैलेंडुला मदर टिंचर, diluted one, and you can use also the cream or lotion, right? Calendula. Cantharis ointment can be kept for burns. बर्नॉल से भी बहुत ही अच्छा इफेक्टिव है कैंथरिस, राइट. पीपल क्या करते हैं, फर्स्ट एड किट में बर्नॉल रख लेते हैं, है ना. So you can suggest them Cantharis. How beautiful it acts. Mask for breathing, rescue breathing के लिए मास्क होता है, CPR मास्क, वो रखना चाहिए. Chemical cold pack and eye shield and eye wash. थर्मोमीटर क्लिनिकल होता है, डिजिटल होता है, इंफ्रारेड होता है, जो भी चाहिए वो ओके रख सकते हैं. उसको कैसे यूज करते हैं वो भी उनको बताना चाहिए. नॉर्मल टेम्परेचर क्या होता है वो भी बताना चाहिए. पल्स ऑक्सीमीटर कैसे यूज करते हैं, किस लिए यूज करते हैं, उससे क्या पता चलता है, ओके. और कितना कम रहेगा तो फिर हॉस्पिटल में जाना पड़ेगा, डॉक्टर के पास जाना पड़ेगा, ये भी बताना है. Glucometer, what is the use of glucometer? It's very important to monitor the blood glucose in case of the known diabetics. Okay, so it is very important. Glucometer with strips, lancets and spirit swabs. अगर लोगों को पता नहीं है तो सिखा सकते हैं उनको, है ना. You can take a nominal charge if you want. You can call them when you call them for the consultation regarding the first aid kit. At that time you can teach them how to use a glucometer. राइट. रूरल एरियाज में बहुत लोगों को अभी तक पता नहीं है ये सब. 2-3 sachet of sugar powder. You can save them expenses also. Okay, and when you teach them all this, but simple thing, they go to a pathological lab and they are charged for fasting postprandial. You can teach them how to maintain a booklet, okay, where they can monitor their blood sugar, they can monitor their BP every day. In case of a known hypertensive or known diabetes, it is very important to monitor if they are having a hypertension, okay. And at that time you can ask them to monitor. When suppose he is under your care for homeopathic medicines, you can ask them to monitor and you can assess that whether your medicines are working or not. So that is very important. So you can teach them how to use a glucometer, how to use a digital blood pressure apparatus. Also, we can keep the 2 to 3 sachets or more sachets of sugar powder in case hypoglycemia. That should be there in the first aid kit. A set of rubber gloves and then homeopathic medicines first aid kit with the reference guide. So first aid reference guide also includes the local phone numbers or emergency phone numbers. So there is a space given in the guide where the local phone numbers the person has to enter. Okay, so this is how the first aid kit is designed. So we don't provide all this, we ask them to buy all these things. Okay, only homeopathic first aid kit you can give them, and if you are selling all other things also you can sell. No, there is no limitation for that. No, or you can ask them, you can contact a pharmacy or some people who sell all these things. That's it. Okay. How was the... Please run the list once again. Okay. What list you want? Medicines, homeopathic medicines? These days we can give to all about 30 years as they have become more geriatric cases. Puja. Right, Pooja, right. Thank you. Yeah, I'll show that. Once again, you can see the list of the medicines. See, this is the first aid kit. What all things are kept in the first aid kit? Those who have missed the earlier slides, I'll just run the slides all one by one. You can just have a look. Okay. Then, were you able to see the slides? Oh, just a second. I missed something. Once again, I show you the slides. Is it visible? Yeah. One more medicine is lachesis, which is used for septicemic emergencies, which Dr. Fras has discussed in his presentation, right? Lachesis, left-sided anginal pain, pain during swallowing. One more remedy, anacardium, was given by me. It was used by me for many times. That is anacardium for anginal pain, along with lachesis. Laurus erasus is one medicine which is given for the, impending myocardial infarction. We get the signals, no? So many times I have used Laurus ceras. Then podophyllum, one for diarrhea, that can also be kept in the first aid kit. Podophyllum. You can, according to your experience, you can modify your first aid kit. Not necessary that what I have given, that only you have to give. Everybody has the experience in their own field. So what I found important, that I kept here. This is very important for the first aid. Okay. And always remember, along with this, you have to provide them 1 hour of consultation, either by discount or free, so that they get a guidance. So one time I'll run all the slides, just have a look at everything. See, this is Grandalia, arsenic and phosphorus relieves from intubation fast. One day I will take a separate webinar for acute cases. Okay, medicines, homeopathic medicines for acute cases. Then Are there? So I'll stop the share now. Done. Stop the slides at 39, 40, and 41. Okay. What is that? Okay. You can take a snapshot of it, but I'm going to send the PPT to all the council members. Okay. Done. Yeah. So done. Now is the question and answer session. You can ask me any questions. Let me stop.